Hi guys, this is Dr. Denny Warren, and I want to share with you some of the tips that we do in our office whenever we're working with kids with ear infections. Now, since 2005, since my wife and I have been in practice, we've worked with many kids with ear infections. We've had really great results. And I think the key to getting those good results is understanding what are some of the major causes of ear infections and how do you address that cause so that the body can heal and function, do what it's supposed to do. And I think one of the things that helps you understand what causes it and how to address it is to understand a little bit about the anatomy of the ear. And there's three main parts to the anatomy of the ear. There's the outer ear, that's the part that we see. There's the middle ear, that's where most ear infections occur. And then there's also the inner ear. And there's something called the Eustachian tube. Eustachian tube is a tube that goes from your throat all the way and it drains, it goes to your middle ear and it drains fluid from the middle ear into your throat. Now a lot of us know about this because anytime we're changing altitude pressure in a plane, we'll hear or feel the pressure increase inside our ear, so we'll yawn or stretch our jaw, we'll try to swallow something. All of those actions will start to stretch that eustachian tube that goes into your throat, and you'll hear your ears pop and crack, and that equalizes the pressure from the outside of your ear to the inside of your ear. And so that's all about opening up that eustachian tube. So normally there is fluid that is produced in your ear, and normally what happens when everything's healthy, then that fluid will drain into those eustachian tubes and they'll go into the throat and everything's fine. Now with infants, one thing you need to know about the eustachian tubes, they're more of a horizontal plane. So gravity's not working very good for us when we're an infant. They can drain into the throat, but it's more difficult for it to drain. That's why ear infections are the most common in infants versus adults, because the eustachian tubes are like this. Now, as we age, the eustachian tubes start to point down as they go into the throat. So gravity is pulling the fluid out into the throat, so it's less likely, it's still possible to get ear infections as an adult, but is less likely to get ear infections as an adult. So if you understand that we need to keep that eustachian tube wide open to allow the ears to drain into the throat, to keep that pressure equalized from the inside of the ear to the outside of the ear, to decrease your chance of ear infections, then if you understand that, then you know one of the major causes of ear infections is inflammation. Inflammation is one of the major causes of ear infections. And if you have inflammation in the upper part of the neck, what will happen is those eustachian tubes I was just describing, that for infants that are more horizontal, the tubes that are open up, those tubes, if there's inflammation, it gets closed up, it swells them shut. And if you swell those tubes shut, it's not going to drain into the throat. And so what happens is the more fluid builds up in the ear, the more pressure builds up, that's where it starts to have pain, and then it's a breeding ground for viruses and bacteria to take off. Then you have a full-blown ear infection. So there's several main causes to inflammation inside the neck, inside the upper part of the neck, inside the ear, that can cause your eustachian tubes to close up. One of the most major causes, and the reason why chiropractic is so effective with ear infections, is because one of the major causes is something called a subluxation. The subluxation is what chiropractors work on in the spine. It's when the bones are misaligned, out of alignment, and they're stuck and they're not getting good motion. When a bone, especially the atlas is the very top bone in your spine. From the birth process, if there's a lot of stress to the baby's neck during the birth process, it can subluxate that bone in the upper part of the neck. It can lock it up where it's not moving. If it's not moving properly, it's going to cause the soft tissue, the muscles, to swell in that area. And if you have swelling and inflammation in that area, the eustachian tube is literally less than a centimeter away from your atlas. So if you're causing swelling in that area from a subluxated vertebra in your neck, that's going to close up the eustachian tube, and it's not going to allow the middle ear and the inner ear to drain into your throat. You're going to have pressure build up, you're going to have viruses and bacteria to start to grow and divide, you're going to have ear infections. So chiropractic is very gentle. The pressure that we use to adjust an infant, to adjust little kids, is oftentimes just a light pressure that you would put on your eye. The pressure that when you're checking an avocado to feel if it's ripe, It's that pressure, that soft pressure. We would put that pressure on the appropriate area in their neck to help realign, help to get that motion back. That will decrease inflammation and allow the ears to drain into the throat. Now, another great technique that you can do is to lightly pull. So you grab the bottom part of their ear here, you lightly pull down on their ear and pull back. And then you also can pull up on their ear. What that's doing is that will actually stretch. It stretches that eustachian tube, and sometimes it'll actually help to open up the eustachian tube so it drains better. Now, if you can get them if the baby is breastfeeding or eating, if you can do that, and the motion of them breastfeeding, moving their jaw, that actually is like you going up in the airplane, yawning or stretching your jaw or swallowing. That helps to open up the eustachian tubes. So that's one of the techniques we always teach our parents, is to lightly pull down on the ears, pull up on the ears to stretch out the eustachian tube, especially if they're breastfeeding, especially if they're eating or drinking. That's the best time to do that, to stretch that out and to open up the eustachian tube. Now, another major cause of inflammation in that area is for the lymph nodes being swollen. Whenever we're sick, we have all lymph nodes in front of our ear here, behind our ear, in the back of our neck, down the front of the neck. And you know this, if you've ever gotten sick, well, when the last time you got sick, you can feel the lymph nodes swelling. Well, that swelling causes more inflammation in that area. That inflammation closes the eustachian tube. So one of the best things you can do is help to promote all the lymphatics to flow out, and the natural flow for the lymphatics in your neck and your head is to flow down towards the heart. So one of the techniques I will teach my moms, not only to pull in the ear to stretch the eustachian tube, but also to have your fingers like this, to actually go in front of and behind the ear and just massage down the neck. So you're just following down, so you have it right in front of and right behind the ear. You're massaging down the neck just to help all the lymphatics to flow in the way they're supposed to decrease that inflammation. Massage is a great technique for that. Another major cause for inflammation, could be causing the lymph nodes to swell, could be causing swelling inflammation in general in your body, is food allergies and food sensitivities. Now, one of the most common things we have moms do is if you're breastfeeding, we'll have the mom cut out dairy, cut out grains, and cut out sugar, processed sugars. Those three are the most common ones that can cause inflammation and swelling in the body. They can cause mucus to build up. And if you eliminate those three, that oftentimes will help take care of the problem as well. Now, another common one, if the baby is starting to eat, and this is very common for babies to have this food, and it can be very beneficial at times, but bananas. Bananas can actually cause mucus to build up in the body. So that's one that if they're having problems with their ears, they're having ear infections, recurrent ear infections, I would take out the bananas, take out, like I said, the sugar, the wheat, and the dairy. Those are the biggest things. Now, some people have extra sensitivities, extra food allergies. There could be eggs, there could be other things. We also, in our office, we do a food sensitivity testing. So for babies, for little ones, it could be a finger prick, and we would just get 6 drops of blood out. We'd send that into the lab, and it'd send us information back about exactly what foods they're sensitive to. So it's what's called an IgG/IgA food sensitivity test. For adults, what we do for that is we can actually do a blood draw. We can send that in, we get the same results back. It'll tell us exactly what foods the person's sensitive to. Because if you're sensitive to certain foods and your immune system's mounting a response to those foods, what happens is the immune system causes a lot of inflammation when it's in attack mode. So that inflammation, again, can cause inflammation in your ear, can cause those eustachian tubes to close up. That way they will not be allowed to drain into your throat. Bacteria and viruses can grow and divide in that situation. Now, the other thing I want to address is ear infections obviously can be caused by bacterial or viral infections in your sinuses, all in your sinuses above and below your eyes, which can go back to your ears, but it also can be caused by just bacteria and viruses in your ears. So what's interesting is the most common cause of ear infections is viral versus bacterial. But the most common treatment for ear infections when you go to a pediatrician is to give a child antibiotics. Antibiotics are great for bacterial infections, but they do nothing for viral infections. And now what actually the American Pediatric Association is recommending is that in America, they're recommending for pediatricians to hold off a few days before you diagnose and before you recommend antibiotics. Because as most people know, antibiotics are causing a lot of problems because we've been throwing antibiotics at everything for so long, and then we have what's called antibiotic resistant bacteria. And so these are bacteria that are so strong that antibiotics are not even touching them. And so just throwing antibiotics at ear infections are not always the best option. Most of the time they're not the best option because most of the time they're actually viral infections. But there is a couple things that we recommend for our parents to do on top of the adjustments with a pediatric certified, a pediatric trained chiropractor, on top of the massage, on top of eliminating the foods. We also recommend two big things. If you are breastfeeding, for your freshest breast milk, so if that child is having some type of immune upregulation where they're trying to fight something off, then the mother is going to sense that. There's sensory nerves in the nipples that will detect if that infant is fighting off something, viruses or bacteria, and the mother's immune system will ramp up these antibodies and will put that into the breast milk. So if you can actually take fresh breast milk during the time when they're having the infection and put that directly into the child's ear, there's a lot of antibodies, a lot of immunoglobulins in the breast milk itself that will help fight off the virus or the bacteria. So putting that directly into the ear is very beneficial for the baby for getting better. Now, another thing that we recommend, if you're in the Fayetteville area, I know that Ozark Natural Foods has this, but it's a product, it's a tincture, and it's in extra virgin olive oil, and it has white willow bark and garlic in it. White willow bark is good for pain. That's the same thing that the pharmaceutical companies, that's what they designed aspirin from. So if they're inflamed, it's hurting, it's really irritated, so that white willow bark can help with the pain and inflammation. But the garlic has antimicrobial properties to it, so it can help with the actual virus or bacteria. So that is one of the best things you could do. The breast milk, if you have that fresh breast milk while the child is having the ear infection, put it directly into their ear. Or if you don't have that, even in addition to that, using the extra virgin olive oil with white willow bark and with garlic. Those things are some of the most effective strategies that you can do to help eliminate, decrease that inflammation, to take care of the viruses or bacteria, take care of the infection, help it to heal. So again, I'm going to recap those things. The biggest thing, if your neck is subluxated due to stress, maybe the child fell, maybe there's stress during the birth process, a pediatric trained chiropractor is one of the best things you can do to address that. And that's why chiropractic has been so good, because it can very gently realign the atlas, the very top bone in the neck, decrease inflammation, allow the Eustachian tubes to open up. Massaging down on the lymph nodes, helping all the lymphatics to flow out of the neck back to the heart the way they're supposed to be. Working on food sensitivities, so eliminate the most common ones. If you're breastfeeding, you're going to eliminate, or even if you're not breastfeeding, your child is eating, eliminate the dairy, eliminate the grains, eliminate sugar, and then also be very careful with bananas as well. If you don't know exactly what they're sensitive to, you've eliminated those and they're still having issues, you might consider doing a food sensitivity testing, the IgG, IgA test. And like I said, we do that in our office. It's a finger prick analysis for kids where we get blood from them. And then it's also a blood draw for the adults if they're having issues. And then finally, the last two things were, if it's from ear infections, from viruses, bacteria, using that fresh breast milk during the time of the infection, because the mom's breast milk is going to change the components of it. It's going to put more immune cells, more antibodies in the breast milk, put that directly into the ear. And then you can also use extra virgin olive oil with white willow bark and garlic. So I hope this helps. If you guys have any questions, please let us know. We'd love to be able to check your child or check you if you have these issues as well. But I hope this helps. Have a good day, and we'll see you on another video. Talk to you soon.